Greetings, everyone. I just want to take a minute to welcome you to this session on how PET-CT is used to detect cancer. And we're going to start with a short video that explains what a patient goes through in a PET-CT procedure, and also what the current operational procedures, not meaning a medical operation, but how we're protecting patients from COVID-19 at UCSF. And so with that, I'm going to disappear and the video will come up.
Welcome to this portion of the Bay Area Science Festival. My name is Erika Padilla-Morales, and I'm a nuclear medicine technologist here at UCSF's China Basin Imaging Center. We're going to talk today about how a PET-CT is used to detect cancer in a patient. PET-CT is positron emission tomography and computed tomography. Together, those two images basically give a functioning image for a radiologist to read and see how cancer is progressing in the body, to detect if cancer is in the body, to see how treatment is going for a patient in the body, or to see if cancer has been resolved in the body. A patient is referred to a PET-CT scan. A patient is referred to our center for a PET-CT scan. They'll come in. Some instructions that they'll get before coming for PET-CT are to fast for 6 hours minimum because our tracer, our radio tracer, is based in sugar. The body uses sugar for energy, and cancer cells use sugar for energy. So we take advantage of the fact that that glucose in FDG is going to be taken up in the body in order to get good pictures of the cancer for a patient. The patient will come in after fasting. We'll bring them back. If they have any metal or any other things on their clothing that could disrupt the picture, we're going to have them change into our pajamas. We're going to start an IV. We're going to check their blood glucose level. Once we make sure that's within range between 75 and 200, we're going to get the radio tracer. We'll inject it into the IV, and then we're going to let the patient relax for about 45 minutes to an hour. That will allow the radio tracer to metabolize in the body. Afterwards, we're going to have our patient use the restroom, empty their bladder. That makes for a better picture, and we'll bring them onto the camera. The imaging session from head to mid-thigh is about 20 minutes. If we have to image more in the body down to the toes, that scan should last about half an hour. After the scan is complete, then we process those images. The patient gets to go home and finally gets to eat. And on the processing side, we're going to make images so this way the radiologist can see the structure of the body, that's the CT portion, and the PET portion, which is showing where those active cells. Together, those images are fused and tell the radiologist where cancer can be found in the body. So that spot that we find in the PET is like a star. The star is bright, but we don't know where it is. The CT is the anatomy. That's kind of like putting that star in the constellation. So PET-CT allows us to find where those cells are active in the body so this way we can get a good diagnosis for our patient. Any procedure that we are offering for you as a patient, including PET-CT, is being done because your doctor thinks that's information that will benefit you and your course of treatment. There is radiation involved in PET-CT. Our radio tracer, FDG, F18 FDG, does have a low amount of radiation, and if a diagnostic CT is being suggested for your exam, that also has radiation. But know that every procedure that we offer is going to be done at a level that's as low as reasonably achievable, a LARA. Your safety is number one. So if your doctor is recommending this procedure for you, know that it's because we want to get good information for your course of treatment. Your PET-CT scan is going to help your doctor know where your cancer is, if you're undergoing treatment, how well that treatment is going, to know if there's any new growth of treatment, and it also might be used to help plan for any radiation therapy that you might be receiving. In the age of COVID, we understand that a patient's health is number one. So we at UCSF have taken precautions in order to keep you safe, to keep workers safe, to keep our community safe. So this way we can continue all the other health care that needs to go on in addition to COVID. So we're going to provide you and us with the PPE that we need, wipe down all of the areas that you will come into contact with to keep you safe, and also to make sure that we don't have any extra visitors here unless it's absolutely essential. We want to keep the population safe that we need to care for.
Hey, good afternoon, everyone. I'm hoping that everyone's doing well. Can I get a show of hands that you can see my screen? I want to make sure that the presentation is viewable. Oh, that's perfect. Thank you so much. And thank you so much for all of you joining us during your lunchtime. My name, once again, is Erika Padilla-Morales, and I'm a nuclear medicine technologist here at the China-based Imaging Center. Today, we're going to talk about how PET-CT is used to detect cancer in the body. But first, I want to wish a happy 10th birthday to the Bay Area Science Festival. I've been attending since 2013. It's one of the best times of the year. I'm excited that we get to do this format that allows people from all over the world to participate, and happy birthday and many more. I want to give an outline for our talk today. So I want to discuss what is cancer. I want to talk about the history of PET-CT. What can patients expect? And of course, we just saw that video, but we'll go into a little bit more detail with that. We're going to review what tools are used to perform the scan and how those tools work. Then I want to finish by offering you resources about PET-CT imaging, and of course for you scientists that are in high school and middle school, to give you resources for how you might be able to perform research with scientists here at UCSF. And if there's time, Q&A. I do have a patient 1:35, so I'll try to be mindful of our time here. Let's first discuss what is cancer. PET-CT is a great imaging mode to detect cancer. But what is cancer? It's a group of more than 100 different diseases. It can develop almost anywhere in the body. It begins when genetic mutations disrupt the orderly development of cells. And there are 4 main types of cancer. Carcinomas, which begin in the skin or the tissue that covers the surface of internal organs and glands. Sarcomas, that begins in the tissues that support and connect the body. Leukemias, which are cancers of the blood. And lymphomas, which are cancers that originate in the lymphatic system. Cancer is among the leading causes of death worldwide. In 2018, there were 18.1 million new cases of cancer and 9.5 million cancer-related deaths worldwide. Approximately 40% of people will be diagnosed with cancer at some point during their lifetimes. And that number is based on data taken from 2015 to 2017. So if we know that there's all this cancer, how can we see it? PET-CT. I'll give you a little background on PET-CT. So to understand how useful PET-CT is in the detection and the following of cancer, know that we performed in the United States over 2 million PET and PET-CT scans in 2018 alone. And it all started less than 100 years ago. In 1928, the cyclotron was invented by Ernest O. Lawrence and teammates, and that produced radionuclides. Radionuclides are the medications that we use to image the body. In 1953, we got the birth of positron emission imaging at MIT. In 1974, PET was used for human studies at Washington University of St. Louis. 2 years later, F18FDG was developed for PET imaging, and F18FDG is the main isotope that we use to image cancer in the body. In 1998, the first PET-CT design came from the University of Pittsburgh. And at the beginning of the 21st century, Time magazine named PET-CT the invention of the year. PET-CT is a form of hybrid imaging. It combines the power of PET, which measures the function of the body, with CT, which images the structure, the anatomy of the body. We know that MRIs and CTs are amazing imaging forms. They show disease, however, once it has changed the structure of the tissues. PET-CT shows disease changes on a cellular level. So cancer can often show up with a PET-CT scan before it can be detected on a CT or MRI image. That detection saves time for the patient and can help the doctor determine what the direction of care is going to be. So we'll review what patients can expect. You've been referred to an appointment for PET-CT with us. We're going to ask you to prepare a 6-hour fast and no physical exertion for 24 hours. We want you to prepare the body to receive the radioisotope of F18FDG, fluorodeoxyglucose. We're going to we're going to place an IV line or access your port, so this way we can get your blood glucose level and also have a means of injecting the radioisotope. If you have diagnostic CTs with contrast, we'll be using that line as well to do the contrast injection. We're going to be taking measurement. We want to make sure that your blood glucose is the right level for our study and possibly measure your creatinine. Again, if you are getting a contrasted CT with your PET-CT, we want to make sure that your kidney function is the correct level to administer contrast in a safe way. We'll do the injection of the radioactive tracer, and then there will be an uptake time of 50 to 60 minutes before we do the scan. And I want to correct from the video, scans can take between 20 and 45 minutes, depending on the nature of the scan, what we're imaging, and how much of the body we are imaging. And then, of course, there are the results. Within 20 to 48 hours, your doctor and your care team will receive those results, and that will help determine what your course of care will be. What tools are used to perform a PET-CT scan? There are basically two tools used for a PET-CT scan. One is a radio tracer, and two is a PET-CT camera. F18FDG is the main tracer that we use in PET-CT. Cancer cells are more metabolically active, and so they may absorb glucose at a higher rate than our normal cells. And this higher rate can be seen on PET scans. On the left-hand side of the screen, you see a molecular model of F18FDG. And on the right-hand side, you see a MIP projection. So you see areas of the body where FDG was taken up.
Erika, we can't actually see your slides. Can you reshare?
Oh, thank you for letting me know. How's that?
Much better, thanks.
Okay, perfect. I apologize for that. So this slide as well, I have a model of the F18 FDG molecule. And on the right-hand side, you see uptake in the body. So F18 FDG and other radioisotopes are made inside our cyclotron, and we at UCSF are really lucky to have a cyclotron on site. So they provide most of our F18 FDG as well as some investigative radioisotopes. And you see the inside of our cyclotron here, which is basically a linear accelerator that's zooming these molecules around until we get the isotopes that we need. Let's talk radiation safety. So again, in the video, I mentioned that any of these procedures that we are suggesting are going to be taken into, safety is going to be taken into consideration. And so we are going to offer a level of radiation that is low as reasonably achievable for you, the patient. We want to keep you safe. Your healthcare team is going to study the benefits versus the risks of the study before offering it to you as part of your potential care. The half-life of F18 FDG is about 110 minutes, so it's a quick-acting radioisotope. It lasts long enough so that we can image well in the body, but not so long as with like other therapeutic doses that it stays in the body for days on end. So pretty much 12 hours after you've had an injection of F18 FDG, it'll be out of your system and it'll be undetectable. The second tool that we use is a PET-CT scanner. So PET-CT scanners combine CT and PET cameras into one unit. One of them being in the front and one of them being in the back. So all PET-CT scanners have some kind of patient bed where we will lie the patient. And you'll see that it basically combines the CT portion, which is in the front of the machine, with the PET portion, which is in the back of the machine. But it's all in one unit. So this way we don't have to move the patient off the table. What's really important with hybrid imaging is being able to fuse the images together. So having these two components in the same camera means that we don't have to move the patient and we get better alignment between both the CT and the PET imaging. Finally, when we get these PET-CT images, we create two different kinds of images. We have the maximum intensity projection, which are these gray and white images where we see the uptake of the FDG in the body. And then we do these fusion images. So when we take the CT, we're getting that anatomy, we're combining it with the uptake in the body, and we get these fused images where we see hot spots in the body. And those are the areas that physicians are going to be looking at, radiologists are going to be looking at to see how a disease may be progressing in the body. The next couple of slides are basically an insider view into our camera. So a lot of our patients have had all kinds of imaging, CTs, MRIs, ultrasounds, SPECT CT. So just know that our cameras tend to be more open than an MRI, and the tube tends to be shorter. So the full body isn't in our scanners, although there are some beautiful full body PET under development that can image a body in less than 5 minutes. So for our claustrophobic patients, that's going to be a game changer, we think. This is the front of our Philips Virios camera. So in the lower left-hand corner, you'll see two rings. That near ring is the CT component, and in the back you see like these gray areas. Those are the detectors of the PET portion that are taking the signals from the radioactive tracer and are combining those so we can see our images. This is another insider view. So on the left-hand side, you see the electronic components that are connected to the detectors. And on the right-hand side, again, you see in the near circle are the ring of detectors that are around the body. And then you see the camera bed. So that camera bed is going to be sliding in between those two components during the scan. So I'm offering some really simple PET-CT resources for you. If you want to see our cyclotron at work, I offer that you click into your search engine and type in the UCSF cyclotron. These are all the radioisotopes structured down there. Cancer.gov and cancer.net are both websites too that offer the full range of how a patient is going to experience their PET-CT. SNMMI.org, the Society of Nuclear Medicine and Molecular Imaging, has a ton of resources about innovations in PET-CT, the different isotopes that are being used and under development to pinpoint, more finely pinpoint where cancer is in the body and the different organ systems. And then finally, the European Association of Nuclear Medicine has created a series of videos featuring Sunny and Tim. They're educational cartoons about nuclear medicine that are aimed for a pediatric audience. If you are a young scientist, I want to share with you that there are opportunities for you to explore with scientists here at UCSF. The CEP program is for you. The URL is cep.ucsf.edu/HS_programs/. There's also a Twitter @CEP_UCSF, and of course cep.info@ucsf.edu. So if you're looking to do research, if you're looking to expand your knowledge about the medical healthcare field, or if you just want to see what else is out there for you, if you have that curiosity, definitely apply for these programs. It's always amazing to collaborate with incredible minds, no matter what the age, because you'd never know where the innovations will be coming from. I'd like to conclude with some acknowledgements with the Molecular Imaging and Therapeutics Director, Dr. Robert Flavell, our lead nuclear medicine technologist, Michelle Swenson, my direct supervisor here at China Basin, Michael Amati, and our entire molecular imaging and therapy team. We love what we do, and we love that we get to combine patient care with all of this technology to see what's going on in the body and to support our patients' health. Finally, I want to say thank you. Again, my name is Erika Padilla-Morales. I have a couple of minutes, but in case I don't get to answer your questions, I'm offering my email address. Feel free to reach out to me, and then I'll be able to answer questions, and probably in more depth than we have the opportunity to do here. Thank you.
So Erika, in the Q&A tab, there are a few questions. Some are very specific. And then others. So one question was, can you explain how PET-CT helps to monitor a possible recurrence of cancer?
Yes. So a lot of our patients come back twice a year, 4 times a year, 6 times a year. If they're part of clinical trials, they might even come more frequently than that. Basically, we want to take a picture of where cancer is in the body, whether or not, if there are tumors involved, if those tumors are active, if they're shrinking. It depends, but these pictures monitor the progress of what's going on. And again, because PET is looking at how the body is metabolizing things, how active these cells are, it's important to know that it's not necessarily, radiologists are looking at all different components of these images. So it's not necessarily, is the tumor big or small, because that's something that CT and MRI can tell you what size it is. PET will tell you is if those cells are active, if there's necrosis, so if the cancer cells are dead or dying in the body as well. So if the disease burden is increasing or if it's decreasing in the body.
Do you have time for one more?
Yes.
A student has asked, how do you become, and they said a radiologist, but I'm going to expand that to be a nuclear medicine technologist.
Sure. So I'll be honest, I didn't know nuclear medicine existed until 2011. I was a teacher before I was a nuclear medicine technologist. Essentially, my path was being a teacher, and then I had an aunt who was diagnosed with cancer, and so I got to see her journey and all of these amazing professionals that supported her. Nuclear medicine spoke to me because I liked that we could make relationships with our patients, as well as use these tools to kind of support them in their journey with cancer. Radiology is a specific field in medicine, and I find that the radiologists that we work with here are just really incredible people, really detail oriented. If you are interested in medical school, I have resources offline that I can support you with, especially if you consider yourself not the #1 student in your class, or if you have a challenge with the sciences and math. There's so many wonderful programs that will support you and prepare you for the medical school experience. So don't discount yourself if medical school is something that you're interested in. There's so many programs to support people to be doctors, because we are going to need so many doctors, and especially radiologists who can read all of the images that we're taking in the future. So please email me and I'm happy to share some of those resources with you.
So I know you have a patient to get to.
I still have a couple of minutes, so let's see if we can squeeze 2 more in.
Okay. Let's see. What type of cell markers are used in the PET test, if any?
So that is for my radiopharmacy people. If you email me, I will find a better answer for you on that, just because I'm not involved with the creating of the radiopharmaceuticals.
Is the
But
machine,
for example, F18 FDG, I know that we are, since we've starved those cells, they're going to take in that glucose because they're hungry. The fluorine, which is the radioisotope, is attached to that sugar. So that is going to be the radiation that's going to be coming off the patient that the detectors are picking, that the detectors are picking up to image the cancer.
is the machine loud like an MRI?
It's a good question. No, it's much quieter than an MRI. The loudest portion of the machine is when the camera bed kind of slides back and forth. So you might hear whirring or clicking, but it's nothing like an MRI experience. That's a great question.
And lastly, one of the attendees has asked if the slides could be available after the talk, and I believe we could post them on our website, if that's okay with you.
Yeah, Yeah, I'm totally happy to share. I'm a very open source person. So again, if I didn't get to answer your questions, please feel free to contact me. And yes, I'm happy to share these slides. They're a good primer, and there are lots of other resources. There's so much to discuss about PET-CT, but I figured that we would give a little slice in this. No pun intended.
I want to defer to you with time because I know you have a patient waiting. So
Yeah, I can stay for 3 more minutes.
3 more minutes. Okay. An attendee has asked, what is the maximum intensity projection?
So the maximum intensity projection, the MIP, is that, should I go back to the slides? It's that gray and white image. We are basically seeing where the tracer is taken up in the body for the maximum intensity projection. We want to see where the tracer has gone. Then we combine that with the CT image, so this way we can see exactly where. We see the brightness with the MIP, with the MIP image, but it's the CT that allows us to see, okay, it's in this section of the body specifically.
2 people have upvoted, how can you take out cancer?
Yeah, I'm seeing that. So it totally depends on the kind of cancer, and I'm not an oncologist, so I'm not speaking from a place of authority, but depending on your type of cancer, surgery might be an option, chemotherapy might be an option, radiation therapy might be an option, a combination of things. So depending on the type of cancer in your body, how much there is, how aggressive it is, your oncologist might speak to you about the different options involved. So this way you can control what's going on in your body, control the cancer. There might be an opportunity to take the cancer out. Depending on the type of cancer you have, it might be a matter of controlling it versus taking it out of the body. Oh, I'm seeing a question about the exercise. So if your muscles are tired and hungry, if you exercise 24 hours before we inject that sugar in your body, the radioactive sugar is going to go to the muscles, and it basically just masks the anatomy inside the interior, and we won't be able to get a diagnostic scan because we'll see some really beautiful pictures of muscles. I see, let's see, the side effects of the contrast to the kidneys. So if the kidneys are weak, basically that iodinated contrast can gum up the system. Kidneys are filters. So if we put the viscous contrast in there and those kidneys are not strong enough to pump that out, that could affect kidney function. And for any students who want to go into the medical field, I want you to be passionate. I want you to think about the sciences and the math that you need, but also think about sociology, think about music, think about art. The best doctors I know are these holistic people. So they don't just think about science as in facts, figures, lots of vocabulary, but they think about medicine as how it's going to affect people in their lives and how to improve their lives, so this way they can participate in their families and their community. Any last final questions? Thank you guys so much for coming. I'll admit, crazy nervous for this session, but I'm so excited that you all participated, and I hope you got good things out of it. You're so, so welcome. Again, please email me. I am more than happy to answer any more questions. I want to thank the team just for taking care of all the technology, for inviting me to participate. And I'm looking forward to next year. Enjoy the rest of the Bay Area Science Festival. There's so much cool stuff. So much cool stuff. Be well, be safe, and be curious.
Thank you so much, Erika.
Thank you.
And thank you to everybody who came to our event today, and we hope we'll see you at others later this week.